Welcome to our comprehensive guide on the HealthTrackRx Respiratory Menu. In this video, we'll explore the various panels available, the specific symptoms each is designed to address, and the pathogens they detect. Our goal is to provide you with a clear understanding of how these targeted tests can enhance patient care through precise and efficient diagnostics. HealthTrackRx syndromic respiratory menus were designed in collaboration with infectious disease physicians to help providers only test for pathogens directly relevant to their patients' symptoms. This approach limits over-testing of the microorganisms not pertinent to the patient presentation and ensures providers only detect and treat what is medically relevant in each patient's case. Our extended respiratory viral acute rhinosinusitis panel covers the primary causes of a viral respiratory infection. It's a great option for patients who have been symptomatic for less than a week who want to know what specifically is causing their symptoms. It can also be a great tool for providers and practices looking to reduce the antibiotics prescribed for acute upper respiratory infections. The Treatable Respiratory Viruses panel covers influenza A and B, COVID-19, and RSV for providers only interested in testing for viruses that have available treatment options. The HealthTrackRx Pharyngitis-Laryngitis panel covers both the viral and bacterial causes of pharyngitis and other oropharyngeal infections like laryngitis or tonsillitis. It helps providers determine the right treatment approach when a patient's primary complaint is a sore throat and point-of-care Group A strep testing fails to provide a clear answer. Our bronchitis panel covers a combination of viral and bacterial causes of bronchitis relevant for patients with persistent respiratory symptoms lasting more than 10 days. Based on the CDC's adult outpatient treatment guidelines, testing for these bacterial targets is primarily relevant when symptoms have failed to resolve. The HealthTrackRx Pneumonia panel tests for viral and bacterial causes of pneumonia and is generally reserved for patients with active sputum production or chest X-ray confirmed opacity. This panel often covers too broad of an array of pathogens for upper respiratory infections, but can be useful in determining the cause of lower respiratory tract infections. Sputum samples are preferred when testing for pneumonia, but considering these samples can be challenging to obtain, an oropharyngeal specimen can also offer sufficient sensitivity. While nasopharyngeal specimens have been shown to have high specificity for detection of pathogens causing pneumonia, they have the lowest sensitivity and should be reserved as a last resort. Lastly, the acute otitis media mastoiditis panel tests for a combination of viral and bacterial causes of otitis media. It's relevant for pediatric patients who have failed an initial course of amoxicillin augmentin treatment, suggesting either potential resistance or an infection caused by an organism with low susceptibility to those antibiotics. Either a swab of drainage in the ear or a nasopharyngeal specimen are acceptable, as pathogens from the nasal passages can drain into the ear, causing otitis media.